Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about syphilis. It's a sexually transmitted disease. In the 1940s, penicillin came onto the market. Incidence dramatically fell. In the 21st century, we're starting to see a rise in the incidence, often in combination with HIV, unsafe sex practices, and men having sex with men, more than 50 or 60% of the new cases, increased promiscuity, decreased use of condoms. In 2017, there were 30,000 cases of primary and secondary syphilis diagnosed in the United States. Early latent syphilis, 34,000 cases. Late latent syphilis, 36,000 cases. Congenital syphilis, almost 1,000 cases. All stages of syphilis altogether, about 100,000 people, which is a 70% increase from 2013. Syphilis is increasing in incidence in all groups, including women, including senior citizens over age 65. It's increased in 36 of the 50 states in the District of Columbia. Right now it's known that 70% of the primary and secondary syphilis cases are diagnosed in the 50 largest areas of the country. In the 1900s, early on, the incidence was the same in men as it is in women, but more recently it's about 10 times more common in men than women, and its incidence isn't spread uniformly throughout the total population. So if we look at who's most likely to contract syphilis, cases 50% in African Americans and about 2 to 1 more common in Hispanics than in Caucasians. And for the first time recently, the incidence is higher in the western United States than it was in the southern United States, where it's been most prevalent throughout the recent past. The highest incidence per capita, Nevada and Washington, D.C., lowest incidence in Wyoming. Just if we look at Oregon, between 2007 and 2014, the incidence has increased 1,000%. It's thought that maybe some of those dating apps, the anonymous dating apps, might have something to do with it because of anonymous sex. If we look throughout the world, in 2015, there were 45 million people who had syphilis, 6 million new cases diagnosed just that year, and it caused 100,000 deaths. Now, more than 90% of the people who develop syphilis are in the developing world. Up to 1.5 million pregnancies were affected, often leading to congenital syphilis, or stillbirths or spontaneous abortions. Prevalence is highest in Southeast Asia, seems to be pretty high in sub-Saharan Africa, where syphilis accounts for about 20% of all of the perinatal deaths. Very high in Latin America and in the Caribbean area. It's caused by a spirochete bacteria. It's only present in humans, only lives for a very short period of time out of the human. It's passed by direct contact with a syphilitic sore for the most part. It can be passed on through oral sex, vaginal sex, anal sex. It can be on the penis or the rectum, can be in the vagina or the lips or the mouth. Can spread from the mother to her unborn child and present as congenital syphilis. The bacteria pass through the mucous membranes and also can pass through breaks in the skin. It's estimated if you have sex with somebody who has primary or perhaps secondary syphilis, the likelihood of your getting it is about 50-50 with one exposure, one sexual exposure. It only takes about 57 of those bacteria to give you syphilis. You could also get syphilis. It could be passed on through wet kissing or sharing sex toys. Seems to be a higher incidence because of social issues in IV drug users and people who use crack cocaine, who trade sex for drugs, and people with anonymous sex. The likelihood of you getting it through a toilet seat or a bathtub or sharing a utensil or some clothing, not going to happen. And the likelihood through blood transfusions, now blood's tested, that's not going to be an issue. The syphilis, once it enters the body, becomes a systemic infection within several minutes, extraordinarily rapidly. Syphilis is caused by Treponema pallidum. It's a gram-negative bacteria that's highly motile, and it has a spiral shape. has a slow doubling time, and in the family of spirochetes, we have the treponema that causes the syphilis, we have Borrelia that causes Lyme disease, and we also have Leptospira that causes leptospirosis. We can divide the clinical aspects of syphilis into primary, secondary, tertiary, and latent phases. The primary, that's the chancre. That's where the organism enters the body. Tends to be around the genitals, could be on the anus or the rectum, especially in men having sex with men. It could be on the cervix and then go entirely unnoticed. It's a round ulcer that tends to be painless. It has a clean border and sharp outlines. Tends to be about the size of a pencil eraser, about 0.2 inches in diameter. It could be up to an inch in diameter in some people. Occasionally, 2 lesions are present, especially if a person has HIV. But unfortunately, syphilis, the chancre, often passes unnoticed or misdiagnosed as something else. Remember, it's usually painless, but sometimes you can have an atypical form where it could be painful, or it could be tender, or it could just be an area of skin that's a little bit reddened. It's a bump near the genitals. Sometimes it's what we refer to as a kissing lesion, where it's on both sides of the labia, on the right side, the left side, where they touch. Could be on the finger or the tongue, could be on the nipples or the mouth or the lips. Tends to occur 3 to 6 weeks after infection occurs. That's the incubation period. The range can be anywhere between 3 days up to 90 days. Once you get the chancre, it tends to heal, even without any kind of treatment, in about 3 to 12 weeks. Can leave a little bit of scar tissue or go completely unnoticed. Then you have nothing that happens for about 2 to 10 weeks. Totally asymptomatic. You don't have any rash. You don't have any chancre anymore. Nothing is there. And then all of a sudden the secondary stage appears. The secondary stage rarely overlaps with the primary stage. The secondary stage lasts another 3 to 6 weeks. And sometimes the secondary lesions may be the only thing that the person sees, because the chancre, when unnoticed, can go unnoticed in 50% of men, 50% of women. The secondary stage is a red rash that resembles a viral rash or a drug rash. Sort of can look like measles. It can be mild, might not even be noticed. It involves the skin and the mucous membranes. Can occur in the mouth, on the vagina. The lesions tend to be relatively small, but they can coalesce into big red blotches about an inch in diameter. Tends to involve, in addition to the body, also the palms and the soles. It can mimic genital warts when it occurs around the vagina or around the anus, except these lesions, unlike the typical genital wart, tend to be a little bit bigger and broad-based and white. Some secondary manifestations may be in addition to the rash. So sometimes people develop swollen nodes or develop a fever or patchy hair loss on the scalp or on the face or on the eyebrows. We refer to this as moth-eaten alopecia. Some people lose weight or have muscle aches and fatigue, and rarely there's some inflammation of the liver or the kidney or the joints or the eyes. The rash tends to be symmetrical, doesn't itch, but sometimes it's atypical. It could be either pustular or annular, circular, it could be scaly, could have blisters. They just don't contain clear fluid. We don't get the blisters with the clear fluid like with the sunburn. We get the pustules. The rash contains infectious bacteria, but in up to 25% of the people with secondary syphilis, that too is going to pass unnoticed. Now, some people with secondary syphilis are going to develop some symptoms of meningitis. They can develop a headache or stiff neck or facial numbness or weakness. Sometimes people can develop problems hearing, sometimes difficulty with sight, ringing in the ears. And after the primary and after the secondary lesions heal, then a person enters the latent stage. Remember, even without treatment, you get into the latent phase. No signs, no symptoms. We divide it into the early and late latent stage. Early is the first year. Latent is after the first year. Well, if you have the early latent phase, sometimes you could have a relapse into the secondary phase, but usually in the late latent, so after you've had it for a year, chances are it's going to be asymptomatic forever. And you can stay in that phase. You don't have to progress to tertiary syphilis. And the nice thing about the late latent syphilis is it's not very contagious or not as contagious as the early latent stage, except if you happen to be a mother, you can still pass it on to the child. Now, in tertiary syphilis, only 1/3 of the people are going to have lesions or symptoms. 2/3 are not going to have any kind of manifestation, even if they go untreated. The tertiary manifestations come on anywhere between about 3 years and 40 years after the acute infection. And we know from some studies that about 1 person in 6 is going to develop a Gumma, and we'll tell you what that means in a moment. About 1 person in 14 is going to develop some neurologic lesions, and about 1 person in 10 is going to develop some cardiovascular problems. But remember, 2/3 of the people with untreated syphilis are going to go on and not have any manifestations, any tertiary manifestations. So the Gumma is what's also referred to as benign tertiary syphilis. It's called benign because it's not life-threatening. It's granulomatous lesions, rubbery lesions, not cancerous growths of variable size. And they could be almost anywhere. They could be in the skin, and the mucous membrane, and the bone, and the liver. They could be on the testes or in the brain. They cause symptoms because of their position and because of the local destruction of tissue wherever they happen to be. Sometimes they could be completely asymptomatic or silent, even if they break down and even if they ulcerate, depending on where they happen to be. Neurologic manifestations occur in 1 person in 14, about 7%. There are several different kinds of forms. There's central nervous system manifestations that actually sometimes may occur as meningitis in the secondary stage. That's usually within 6 months of developing the primary infection, where we find some abnormalities of the cerebrospinal fluid. But more importantly, in the tertiary phase, we develop some problems with the meninges. You develop a type of a meningitis or type of problem with the blood vessels that go to the meninges and sometimes to the brain and to the cord. We develop infarctions, various symptoms. People can have diffuse pains and cranial nerve palsies and abnormalities of the pupil. People can develop stroke, or people can develop a standard or basilar type of meningitis. And later on, it involves the actual substance of the brain itself. Significant problems manifest as apathy or seizures or what's known as generalized paresis, form of dementia. The other major manifestation is what we know as tabes dorsalis, where people have poor balance and sharp lancinating pains in the extremities. If we talk about the tabes dorsalis that affects the cord, causes some joint damage, causes what's known as foot slap, causes peculiarities of gait, broad-based gait, because these people have impaired position sense. They don't exactly know where the foot is, where the leg is. They have impaired vibration sense. They have impaired pain and touch sensation. Sometimes these people end up incontinent or impotent. And then they can go on to develop generalized paresis, previously generalized paresis of the insane. It mimics other forms of dementia with impaired memory and speech and personality changes and irritability. People can become psychotic. It can involve the eye. When it involves the eye, we call it the Argyll-Robertson pupil that is typically constricted and doesn't respond to light. When it involves the eye, it might cause some eye pain or blurry vision or visual loss or retinitis or inflammation of the nerve that leads into the brain from the back portion of the eye. Obviously significant, and especially so if a person has HIV, tends to occur much more rapidly, the eye symptoms and the neurologic symptoms. Cardiovascular disease, about 1 in 10 individuals going to develop problems with the ascending aorta, the aorta that goes from the heart up to the chest before it turns around and goes down into the abdomen. Well, in the area of the chest, the blood vessels that supply the aorta itself are affected, and that can lead to some ballooning out of the aorta. We call it an aortic aneurysm. Also some insufficiency of the aortic valve. That leads to a diastolic murmur and some chest pain or some back pain, sometimes difficulty breathing. And in pregnancy, there's also an issue where the spirochetes readily cross the placenta. If a woman is infected, her newborn or her infant or her fetus has about an 80% chance of infection. 40% of the time it's going to lead to miscarriage or stillbirth, depending on the timing of the infection during the pregnancy. Low birth weight, prematurity, very common. Congenital syphilis divided into two forms: the early, less than 2 years after infection; late, more than 2 years after the infection. Estimated that typically in the United States we have between 500 and 1,000 cases of congenital syphilis that are diagnosed. Well, 2/3 of the babies when they're born don't have any symptoms. The common symptoms that occur during the first few years of life might manifest as an enlarged liver, enlarged spleen, rash, fever, lung inflammation, some of the neurologic changes, sometimes a rash. It looks again like the measles, can have blisters with clear fluid in them, can have some bleeding into the skin, some facial characteristic abnormalities, can have cataracts and seizures, and a little bit later on in the late congenital syphilis, problems with the teeth, problems with the bones, problem with the joints, and also some frontal bossing of the forehead, some problems with the optic nerve or some deafness. Now, it's recommended, of course, by the agencies that make guidelines that all pregnant women should be screened for syphilis, at least during the first prenatal visit, and then oftentimes again in the third trimester. It's important to realize that histologically, it's not a specific look. If we take a biopsy of a lesion of syphilis, it shows some inflammation around the blood vessels, typically with some plasma cells, which are a type of a white blood cell. And they're characteristic of syphilis. But you don't get any immunity even though the plasma cells are there. It seems that the immunity to syphilis is not complete. It's partial immunity. So if you have syphilis and you don't have any kind of treatment, it's possible that you can again become infected. But typically when you become infected for the second time, you're going to not develop a chancre. You go right to the secondary stage, or sometimes even to the tertiary stage. Well, even if you're treated, same sort of situation may develop. The testing that we have is pretty good. It's blood tests, it's a VDRL blood test, an RPR blood test, very commonly performed. But sometimes they give the wrong information. It takes them several weeks to become positive, and then they sometimes are positive even if you've never had an infection. They become increasingly positive as we grow older, maybe with some viral infections or pregnancy or connective tissue disease or a variety of other medical conditions. Well, it's very important to realize that most of the time, with appropriate treatment, those tests are going to go back to negative, except if you happen to have HIV. If you happen to have HIV, then chances are the tests are going to be long-lasting and positive. If we get one of those first tests, the VDRL or the RPR, and it's positive, we want to confirm it. We want to do a second test, typically called an FTA-ABS test, fluorescent treponema antibody absorption test. And that really is much more specific. So if we have the one test and the other test is positive, then chances are you have syphilis. It's a notifiable disease, and the chance of acquiring HIV if you happen to have primary syphilis is increased. It's increased by 2 to 5-fold, especially when the chancre is there that's ulcerated, because the ulcer causes a variety of blood cells to infiltrate into the ulcer that are the home to the HIV. And in certain urban areas, the co-infection rate among people who have syphilis, about 50%, also have HIV. Now, in former times, syphilis was a devastating condition, and people would have terrible pain, and they would have neurologic symptoms that became present extraordinarily early, and people would die within a year of having syphilis oftentimes. Sometimes it would linger longer. But it was a horrible disease. The agent was found in 1905. It was known to be sexually transmitted, but we didn't know exactly what the cause was until about 1905. Then, 1910, developed the first semi-helpful medicine. It was known as salvarsan. It was an organo-arsenic compound later mercury, and then in 1943, penicillin. Well, there was a study that was performed lasting from 1946 to 1972, the Tuskegee study, that was performed in Atlanta. And that was a study where, 1932 to 1972. And that study looked at men, black men, who had syphilis, had the diagnosis, who were untreated, even untreated after penicillin was developed. And that's how we got the statistics for knowing about the tertiary stage. The treatment of penicillin, treatment of syphilis, relatively easy. It's penicillin. One injection of benzothane penicillin cures primary, cures secondary disease. If for some reason you can't take penicillin, there's ceftriaxone or doxycycline, but syphilis is resistant to erythromycin and clindamycin and a variety of other agents. If the benzothane penicillin happens to be unavailable in some other country, not in the United States, but the procaine penicillin is also acceptable therapy, but it has to be given much more frequently. Once a person is treated, then very soon after, like an hour after treatment, the organisms break down. And when the organisms break down, they liberate a variety of substances that causes the body to react, and then the person really feels awful, develops fever and headache and muscle pains, tend to be gone by about 24 hours. Penicillin is the only treatment if a person has the neurosyphilis stage or the congenital syphilis or syphilis during pregnancy. And if you have late syphilis, then multiple injections are required. Well, the good news is that there's a great prognosis with treatment for the primary or the secondary or certainly the early latent stage. And as long as there's not a permanent complication, the treatment with penicillin is really good. Now, of course, if you're deaf or if you already have an aneurysm, that's beyond what penicillin can cure. So there you have it. That's syphilis. It's coming back. And in certain areas of the country, it's an important disease. So be careful. Thanks for watching. I'm Dr. Ken Landau.